Hi everyone, this is Dr Mahima Bakshi. Welcome to my show. My today's guest is Dr Meenakshi Ahuja, Senior Director Obstetrics and Gynecology, Fortis Lafemme. Hi ma'am, welcome to the show.
Thank you so much, Mahima, for having me here.
So you know you were my favorite, all-time favorite.
Thank you.
So I've been super excited to do this episode with you.
I'm absolutely excited too.
So I would love us to talk about pregnancy in 30s because nowadays we see women getting married at a later age, planning pregnancy at a later age, and pregnancy in 30s is something which is becoming so common. So I want us to give comfort to women in their 30s because if they are thinking कि pregnancy plan करना है तो बहुत लोगों के मन में ये सवाल उठता है कि क्या 30s एक बहुत ज़्यादा लेट एज है for a female to plan a pregnancy. So I want us to today give that comfort to women so that जिनको plan करना है they can comfortably know that yes, it's okay for you to come discuss with your doctor, with your gynecologist and have a safe and healthy pregnancy ahead. So सबसे पहले आपका इस बारे में क्या कहना है कि when women want to plan a pregnancy in their 30s, is it safe for them?
So, medically, very clearly, the safest time to plan a first pregnancy at least is in your 20s. So, we see least complications at that time. Fertility is good, conceiving is easy, and complications are going to be less. But like you see now, more and more girls are getting educated, they're empowering themselves, and it's very important, career and home and everything needs to be balanced. Also, I think it's a good idea if girls are living some part of their life before they get married and have children. Yes. So more and more girls are going to be planning pregnancies in their 30s. So don't delay too much in the 30s. Don't make it the late 30s, definitely. Early 30s, I don't think there should be much of fertility issues. Should not if you're healthy, fit. Because obviously, I believe that, if you're having kids in your 30s or getting married or giving these things a priority, work with your mind and body earlier when you are focusing on other things so that there are least complications when you plan pregnancy in your 30s. So, frankly, if you're seeing a gynecologist, you plan properly, probably see a doctor once or twice in your 20s, check that fertility is okay. It's good to wait. Then after that, planning pregnancy in your 30s should be a breeze.
Lovely. Also, a lot of women these days are, being diagnosed with PCOS. And that's when women start freaking out that, oh my God, I have PCOS, which means when I get married or, when I plan to get pregnant, I'm going to face a lot of issues. Pregnancy होगा, नहीं होगा, PCOS है तो क्या ऐसा है कि मुझे pregnancy हो ही नहीं सकता है. So specifically something for women with PCOS and when they are entering their 30s, आपकी साइड से उनके लिए आप क्या कहना चाहेंगे?
So, you know that PCOS is almost like an epidemic. 60-70% girls in the cities will have PCOS. You know that it's going to cause fertility issues later. So, it's very important to correct it at the right time. So, PCOS may be the commonest, but if you ask me, it's probably the most gratifying disease to treat. Okay. Because, the person gets into a better health and then having a pregnancy because ऐसा नहीं है कि यूट्रस खराब है या ट्यूब्स खराब हैं या कोई और फैक्टर है तो just taking care of your health at the right time you will see to it that there should be no problem in pregnancy. So keeping an ideal weight, lifestyle even before you plan. So like you said कि PCOS तो पता तो बहुत पहले लग गया था. And the good thing is there was a time when unmarried girls, when I was practicing say 30 years back, it was almost like mothers बड़ा छुप के बच्चों को लाती थी अपनी ट्रीटमेंट के लिए PCOS के लिए. केमिस्ट भी दवाई को कहते थे ये क्यों ले रही है दवाई, गायनी के पास क्यों गए. Now it's very common. And I think when PCOS is diagnosed or you suspect that you have PCOS, it's very, very important to see a gynecologist, get it sorted, keep it maintained that there is no PCOS so that there's no problem when you conceive.
Absolutely. So I think awareness is something which is very, very essential for women these days.
Absolutely.
Great. Also, ma'am, when a woman wants to start planning her pregnancy, what are those particular things that she needs to keep in mind? Any particular medication, any particular test that she must get done before she wants to get pregnant, any particular lifestyle changes that you would like to advise? So जिसने सोच लिया कि ओके ठीक है अब मुझे जो है अपना प्रेगनेंसी प्लान करना है उनके लिए आप क्या एडवाइस देना चाहेंगे?
So very rightly said, like we just discussed, कि पहले तो अगर कोई और medical issue है 20s में, just sort it out. And then whenever you say at 30 you don't want a baby, 31, 32, come for your annual check to the doctor to see that there's nothing going wrong. कोई नया fibroid नहीं बन रहा, कोई polyps नहीं बन रहे, कोई cyst नहीं बन रहे. Now if everything was okay, now you plan a pregnancy. तो उसके अंदर at least 3 months prior to planning a pregnancy, we call it a preconception counseling. Ideally, it should be done at any age, even if you're planning a pregnancy in the 20s. See your gynecologist for a pre-pregnancy counseling. वो आपकी पूरी हिस्ट्री लेंगे, देखेंगे कि आपकी फैमिली हिस्ट्री में कोई प्रॉब्लम है, आपके हस्बैंड की हिस्ट्री में कोई प्रॉब्लम है, कोई आपकी कोई पास्ट हिस्ट्री हो जो पर्टिनेंट है, so that when you conceive, everything is ideal. That's the point. No, you want to plan your pregnancy in your 30s because you want everything should be ideal. Then make it ideal. And we give that 3 months ki eat healthy, take care of your diet, take care of your exercise. BP थोड़ा सा बढ़ा है तो कम कर लो, weight थोड़ा सा ज़्यादा है तो कम कर लो, कम है तो ठीक कर लो, vitamin deficiencies है तो ठीक कर लो. And of course, we start folic acid. We start folic acid prior to conception so that we avoid the risk of neural tube defects. Also, there may be some vaccinations that we would like to give you. So, जैसे अब चिकन पॉक्स आपको अगर प्रेगनेंसी से पहले नहीं हुआ है and you are not immunized against चिकन पॉक्स, चिकन पॉक्स की वैक्सीन लगेगी, उसके बाद 3 महीने आपने कंसीव नहीं करना. ठीक है. Similarly, rubella है. If we give the vaccine, we don't want you to conceive for a month after that. So obviously, if you've seen us and why are we worried about these diseases? क्योंकि अगर ये pregnancy में by chance हो गए, तो baby को problems हो सकती है heart में, cleft lip, cleft palate, and other problems will occur. So these can be easily prevented by immunization. So if you've seen your gynecologist 3 months prior to when you plan a pregnancy, we can give you the vaccinations if required. We can get you onto the right lifestyle. कोई high risk factors है उनको ठीक कर ले. So that pregnancy is easy peasy.
So very important to ensure कि आप जब सोच ले mentally कि आपको pregnancy plan करना है, चाहे आप 20s में या 30s में है, it's important that you must visit a gynecologist once, discuss with her so that she can do the entire preconception counseling. And अगर like ma'am said कि कोई अगर health issues हैं तो उसको आप pregnancy plan करने से पहले sort out कर ले so that you have a healthy pregnancy ahead. So ma'am, now suppose a woman has gotten pregnant in her 30s and in her pregnancy, कई बारी लोग आसपास के डरा देते हैं कि अरे आप 30s में आप प्रेग्नेंट हो, आपका तो बहुत ज़्यादा कॉशियस आपको रहना है, आपको बेड से नहीं हिलना है, आप जॉब वॉब छोड़ दो, यू कैन डू एनीथिंग, जस्ट स्टिक टू द बेड. तो 30s की प्रेगनेंसी में हाउ ईजी इट इज़ फॉर अ वुमन टू मूव अराउंड, टू गो टू हर ऑफिस एंड टू हैव अ नॉर्मल लाइफ ड्यूरिंग हर प्रेगनेंसी. आपकी साइड से आपका उस बारे में क्या?
So unless of course there's any high risk factor like placenta previa या कोई bleeding हो रही है pregnancy, I would advise that you be as active as possible. If anything, आपकी risk of blood pressure, risk of diabetes, which are probably the biggest risks that we think as age advances, वो minimize हो जाएंगे अगर आप time पे अपनी exercise और fitness पे concentrate कर रहे हो. Also, your mental health is important. I think going to work, interacting with people is very important. You can't be tied down to the bed. So in fact, we even allow our girls to travel if everything's okay. तो ऐसा कुछ नहीं है कि pregnancy में आपने bed rest, बल्कि it's opposite. जितना आप active होगे उतना pregnancy में अच्छा है.
So I think it's important that husbands take extra care of this thing. Ki if the wife is pregnant, please let her be as active as possible. Of course, you have to take a green signal from the doctor, from the gynecologist. And if you're getting the green signal, take extra care of her, take her out. You guys can even plan a baby moon, a baby staycation in pregnancy, which a lot of couples are doing these days. Get your photo shoots done, make memories in pregnancy, and try to enjoy the pregnancy as much as possible, but 100% under medical supervision.
Absolutely. And here I would like to bring in a part that exercise is really very important. So probably because, work, even if you're working from home, work starts at 9, finishes at 6. Sometimes it extends till 9. You have help at home to do the general household work because you're working. So that thing that you take out time to exercise properly. It's not just walking. So I always say that if you want a normal delivery, you need to have the stamina and you need to have the flexibility. Stamina will come from your nice long walks that you take. That's also mentally relaxing. Go with your partner, go on your own if you want little me time, but do those walks every day. Along with that, spend half an hour every day on some sort of fitness exercise under supervision, obviously, so that your body is flexible and it helps you with normal delivery.
So well said. Exercising is so important, and especially if you're pregnant, you can enjoy different forms of fitness, different forms of exercises in pregnancy. And ideally at least 30 to 40 minutes की आपको pregnancy exercises daily ज़रूर करनी चाहिए, कोशिश करनी चाहिए at least for 30 to 40 minutes. But don't overgo also, because sometimes I've seen women being so obsessive कि वो 2-2 घंटा pregnancy में exercise कर रही हैं.
It should be under supervision with someone who deals with pregnancy.
Yes, absolutely. So take care of yourself, take care of your baby, and take care of your pregnancy. So ma'am, since आपने mention किया है about normal delivery, you know, a lot of stamina is needed, flexibility is needed. कई बारी लोगों को ऐसा लगता है कि 30s की pregnancy है तो मतलब 100% वो C-section ही होगा, और 30s में एक normal delivery करना तो बहुत ही मुश्किल है या impossible है. So आप practically अपने daily basis पे you must be coming across so many women who are pregnant in their 30s. तो आपकी practical experience से आप क्या बोलना चाहेंगे?
Frankly, I think today I see more pregnancies in 30s than their 20s. And I always call it a law of average. If you keep everything fine, average, that is the baby size is average. Baby is not too big, not too small. Your blood pressure is average, it's in the range, your sugars are in the range, your hemoglobin is fine. There are no other complications. There is no reason why you need to have a C-sec. C-sec will be done only if there's a reason for a C-sec to be done. If you keep everything good, you take care of your overall health, take your supplements, take care that your blood pressure remains fine, your sugar. So usually, 80% will be with your diet and activity. And mental health, of course. So BP ठीक रहेगा, sugars ठीक रहेंगी, सब कुछ ठीक रहेगा. There is no reason why you should not have a normal childbirth. I think every woman should aim for a normal childbirth unless there is a contraindication to it. And secondly, of course, I personally feel that if someone is, very traumatized with the whole thing, and a woman's choice should always be respected.
Absolutely. So I think you have to work hard to aim for a natural birth.
Absolutely.
It's not something कि आप पूरे 9 months, you're not following a healthy lifestyle और अब last minute doctor को बोलो डॉक्टर मुझको तो normal delivery चाहिए.
You have to work for a normal delivery.
Great. So ma'am, ये तो हमने discuss किया about women who are planning for their pregnancy in 30s. Now suppose, there is somebody who's not even decided to get married and has entered her 30s, and of course is more worried and anxious about कि later on जब मुझे pregnancy plan करना है, I'm not yet sure कि मैं किस age में pregnancy plan कर पाऊंगी. So for those cases, what is your advice?
So usually I think, like I said, if there's any medical issue, if your cycles are not regular, if there's severe pain during your periods or something, you should be seeing a gynecologist in your 20s also. Also, if you're sexually active, your pap smear and everything else needs to be done, see a gynecologist regularly. Once you've reached your 30s and you're not planning a pregnancy, you must see her every year. Fertility needs to be checked also. Fibroids, polyps, anything can develop. And by the time you're ready, then there would be issues. Also remember that after 35, your eggs start aging. So people keep on getting fertility tests, like there's something known as AMH, they get it done. So AMH is a number which is telling you the number of the eggs. It's not telling you the quality of the eggs. The quality of the eggs are going to deteriorate as age advances. So if say someone at 30 doesn't have a partner and is not thinking of marriage or childbirth right away, the first thing I'll say, when do you think you would be considering it? Or someone has a partner but they're not contemplating children at this point of time. So if their fertility is okay and all the tests are fine and they want to plan in a couple of years, so be it. There's no problem. Just come for your regular check and come. There are girls who will say, no, at 32, no, I don't have a partner, or I don't think I want a child before, say in the next 5 years. है ना? Or 6 years. So 35 के बाद आपको पता है आपकी egg quality deteriorate होगी. Chromosomal abnormalities ज़्यादा होंगी. Chance of fertility may be a problem. There could be, that miscarriages are more. So you won't want the best quality of your eggs. Your eggs are the best quality at that age. So if you know that, say at 30, 31, you're not contemplating a pregnancy for the next 5 years at least, just freeze your eggs. Similarly, if your AMH is getting low, or there's another issue and you want maybe 3-4 years later you want to plan, but you're not sure if your eggs would be there or not, just freeze your eggs. It's a very straightforward procedure. It's not a painful procedure or something. Can be done in one cycle itself. You have that as a bank balance. So your running income you have. Your eggs are there with you. So if At 35, it doesn't mean, because the eggs frozen, you must understand that you're going to conceive with IVF, because those eggs are going to be mixed with the sperms and then they're going to be put in the body. So 2 things here I want to tell you, that even if your eggs are frozen, it does not mean that you can't plan naturally. So if at 35, 36, you are planning a pregnancy and you conceive naturally, it's perfectly fine. If there's an issue, you have your eggs which are from the time you were 30, 31 or 32. So they're definitely much better eggs, right? So that's a very important thing. The second thing is that, say you're married, and you don't want a baby right now. So you've kind of predetermined who your partner is or who is the person you want to have the baby with. Then probably a better idea is embryo freezing rather than just egg freezing.
Okay.
So get your embryos made, because usually what's going to happen, if you have 15 eggs, you think that it's a great bank balance to have, but maybe we get only 6 good embryos with that, or 5 good embryos with that. So when you're freezing your eggs, if your partner is already with you, then it's a good idea to freeze embryos rather than the eggs. At the same time, considering the circumstances and how life takes you, one doesn't know how life takes you. Probably, freeze some of your eggs as embryos and keep some eggs aside as eggs also. So those options are all there. And probably if you discuss with your gynecologist, you would get whatever is the best option for you.
Lovely. So I think science has advanced so much in last couple of years that we have options like egg preservation, embryo preservation available in today's time.
Absolutely.
Great. So I think this has been a great discussion about how women in 30s need not be scared if they have to plan a pregnancy, but important is that you discuss it with your gynecologist so that you get the right kind of advice and you're able to take care of your health before you plan the pregnancy. So ma'am, आपकी साइड से एक takeaway message हमारे viewers के लिए.
I think a regular checkup is very important, irrespective of when or if you plan a pregnancy. It's very important that your gynecologist is almost like your friend, your confidant, because there's so many things you may not want to discuss with, say, family, or you feel they will give you a biased answer or an approach. So your safety and your health is in your hands, and probably the best person to help you with that is your gynecologist.
So look for a best friend, look for a gynecologist whom you can trust, you can discuss your internal issues, your health issues, and you can always have a healthy discussion about planning a pregnancy, post-delivery issues, and definitely later on जब menopause आता है तब भी gynecologist की ज़रूरत पड़ती है. तो एक best friend आपको एक gynecologist में ज़रूर ढूंढना है. And अगर आप एक best friend ढूंढ रहे हैं gynecologist में, so I would also love to recommend Dr Meenakshi Ahuja, who is available at Fortis Lafemme. You can come and meet her anytime. If you want, you can take an appointment also, but I will definitely recommend her for sure, because for my issues, I know I only come to her.
Thank you so much, Mahima, for the kind words.
So it was lovely chatting with you, ma'am. Thank you for sparing time.
It's been an absolute pleasure.
Thank you so much. Thank you for watching. Don't forget to like and share this video.
Thank you.